Good morning. You know, there are so many people that suffer from asthma, especially this time of year. It can be not much fun. And if you or someone you love is living with asthma, there is some great news. Dr. Joseph Diaz with Allergy SA is here with more. Good morning.
Good morning. Good morning. Good to be here.
Good to see you. You know, you hear about asthma a lot in children, but a lot of adults are suffering with it as well, aren't they?
Right, absolutely. It's more common to develop asthma in childhood, but it's not uncommon to have asthma symptoms throughout your life and even to develop asthma later on in life.
So there are obviously different levels of asthma severity, right? So some of it can be controlled, some of it is uncontrolled. What is the difference?
It's a little bit complicated.
Okay.
So asthma is really quite common. About 1 out of 10 kids have asthma. It's the #1 reason kids go to the emergency room. It's the #1 reason kids miss school. So when you have asthma and you have the symptoms of asthma, it can be categorized into mild, moderate, or severe, and we have kind of algorithms that help us make that classification.
Okay.
But it's not just about severity. When we see patients in the office, it's really about asthma control.
Okay.
And gaining control and getting control of your asthma is even more important than the severity of your asthma. And just one quick thing is about 50% of patients that have asthma are uncontrolled.
Oh, so they're living, I mean, it can be miserable, obviously. So what are some things that you do and ways that people can control it?
So if you have asthma symptoms, coughing, wheezing, shortness of breath, waking up at night, in kids, chronic cough is the main symptom of asthma. If you suspect asthma, you should probably be seen by someone. In the office, we measure lung function. We check lung function, which is critical, because if you're not measuring the lung function, you really don't know what's going on in the airway.
Right.
And you evaluate these patients for the severity and for the control. And then there's all kinds of therapeutic interventions now. There's the old stuff, and there's a lot of new things that we use for the treatment of asthma, especially in the more severe asthmatic, which is where the real focus is right now.
Yeah, so how do you treat the severe asthma differently?
So the severe asthmatics, those are the ones, there's about 10% of asthmatics, and there's 20 million asthmatics in the country.
Oh, I had no idea.
Yeah, about 10% of asthmatics have severe asthma. And the impact on economics and the impact on their life can be quite significant and devastating. Until more recently, we used to just treat with the same medications and increased medications, and now, over the last few years, there are new medications that are available called Biologics. And they're basically monoclonal antibodies and injectable medications that have really revolutionized the treatment of asthma. We are now able to control many of those severe asthmatics.
You know, a lot of people, when they think about, people with asthma, all they ever see is the little pumps, the little inhalers. You picture that, but obviously people still use that. But it's nice to know there are such new advances.
Yeah,
to make it better for people.
Major differences. I just got back from our academy meeting in Orlando for a week, and the majority of the conversation around asthma was using these newer medications that not everyone is using. But they will eventually become the mainstay of therapy, I think, for these patients. They're called biologics.
Okay. Well, here's the thing. You have 3 locations. So if you are suffering from asthma, if you have somebody else, someone who you love is suffering, maybe they have severe asthma symptoms, you can always get in touch with Allergy SA. Again, 3 locations in San Antonio, 210-616-0882. You can also go to allergysa.com, or you can find them on Facebook. Just search Allergy SA. Dr. Diaz, thank you for being here.
Thanks, appreciate it.
Nice to see you.
Good to see you too.
And you guys stick around because